Hey, what's going on, guys? Jomar Ferrales here, Doctor of Physical Therapy. Today, we're going to go over the final part on how to do a PT evaluation in Spanish. And the fourth part is just the conclusion, okay? This will be a quicker video since it is the conclusion, but in order to wrap up a PT evaluation, you need to be able to kind of close it out, right? But before I get into that, make sure you hit the like and subscribe button below. Also, too, I am attaching the PT evaluation Spanish script that I use for home health in the comment section, so you can go ahead and download that for free if you'd like a written reference that you can practice with and maybe modify and add yourself, okay? So in the conclusion, I generally like to just tell the patient how often they're going to be seen, thank them for their time, and make sure that they have all their questions answered in terms of what the expectation is and what they're going to be receiving. All right. So we went over part one, where we went over the introduction and how to introduce yourself and how to confirm that they're actually the patient. Part two, we went over how to do the vitals and the objective portion. Part three, we went over the functional assessment, checking bed mobility, transfers, gait, and administering the standardized measures. So part four, we're just gonna go over the conclusion and wrapping things up. So at this point, the patient is already done. They're seated probably where you started the evaluation. And all you're gonna say is, you want to tell them first, like, what you think from your evaluation, how often they're going to be seen. That's basically the most important part. So all you're going to say is, tu terapia es 2 veces a la semana por 4 semanas. Now, this is where knowing some numbers may help. I'm going to be making future content on how to say numbers in Spanish. But typically in the home health setting, 2 week 4 is not something atypical to see for a PT plan of care. And that's basically what I said, that you're going to be seen twice a week for 4 weeks. And, that is their frequency. So you could also say, tu frecuencia, your frequency, es 2 veces a la semana. Semana means week, por 4 semanas, okay? And then you could also say, since in the home health setting, typically after 4 weeks or in 30 days, the registered physical therapist goes in and does their PT reevaluation and supervisory visit with the PTA. You could say, yo vengo aquí, I will come here, otra vez en 4 semanas, okay? That kind of gives the patient a general idea that you will be coming back in 4 weeks. And in order for them to understand that they will be seeing your assistant, if you do pass off patients to PTAs, you can just say, mi asistencia viene aquí en la próxima día or in la próxima semana. So that just means my assistant will come here, and depending on your frequency, next week or the next day. Próxima means next, okay? So you could say próxima día, next day, or próxima semana, next week, okay? So that's typically what I say. I say, tu terapia es 2 veces a la semana por 4 semanas. Mi asistente viene aquí para tu terapia. My assistant will come here for your therapy. Yo vengo aquí otra vez en 4 semanas para tu reevaluación. They will understand that you are coming back for a reevaluation. Just say reevaluación, okay? I've never had a patient question what that means. They typically understand that, you're going to be coming back for a reevaluation as long as you say that, okay? Now, the second part is you're just going to thank them for their time. You know, in the Spanish culture, it's very good to thank them for their time and to just show that you're grateful for them, for you being able to come to their home or to their place of residence. Just say, gracias por tu tiempo. Thank you for your time. That's basically all you have to say to end the eval is thank you for your time. Now, if you happen to know quite a bit of Spanish and your understanding of it is better, you can go ahead and just say tienes preguntas, which means do you have any questions? So depending on your skill level, you know, you may forego that question. I'm not saying you have to say that, but you can if you want. Typically when I've asked that, they really don't have any more questions. I will also say too, since I work for a home care agency, you can just say, tienes más preguntas. If you have more questions, puedes llamar. You can call la agencia, the agency. So, tienes más preguntas, tú puedes llamar la agencia. And then you can just show them the number on typically their packet or their folder that every home care agency gives to a patient. All right, so that is part 4, the conclusion. I told you this would be a quicker video. To wrap up the PT evaluation is not very hard. And again, guys, it just takes practice. It just takes saying it and doing it more and more in order for you to get more comfortable. And I kind of had to accept that since many of my patients were Spanish speaking only or are Spanish speaking only patients. And by following this script, you're going to be more confident, you're going to have less anxiety, and you're going to be able to speak basic Spanish to these patients, and you're going to be able to complete an evaluation. And your patients are going to be thankful that you are trying to speak in their native language, regardless of how fluent or good you are, okay? Keep in mind that these patients mostly do not speak a lot of English. So when they have someone trying to speak to them in their native language, they're really appreciative, and I've never had an issue. So if you like this video, you can go ahead and hit the like button, and please be sure to subscribe for more content. I will talk to you guys later.